Welcome to GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.
Mental health in cancer. Think A to G. Our specialist is Anne Crook. A. Ask about psychological symptoms.
We know that people affected by cancer are more likely to struggle with their mental health. And psychiatric diagnoses are very common in cancer patients and are highly treatable. People may already have struggled with pre-existing mental health difficulties prior to their cancer diagnosis, and so carry out an assessment and treat as you would for any other patient. Untreated mental health symptoms can adversely affect morbidity and mortality in cancer care.
B. Be alert to trauma.
As well as anxiety and depression, people may also experience trauma going through cancer care. The diagnosis and treatment can be traumatic in itself. And sometimes going through cancer treatment can re-trigger previous traumas from earlier in their life. And so make an assessment and early intervention may be needed.
C. Cancer care review.
Cancer care review can be helpful at any point in the cancer pathway. Cancer has an impact on every aspect of life, and the review provides an opportunity to normalise and validate people's feelings, to help them identify what's going on, and perhaps to signpost to further care.
D. Daily living.
Cancer inevitably has a physical and psychological impact on every aspect of life. But it's important to treat and intervene when it's having a significant impact on people's day-to-day living and interfering with getting back to what they want to do.
E. End of treatment.
The end of treatment is a difficult time for most people. This is when they try to process what has just happened to them. People can often feel alone after the intensive treatment has been completed, and they discover that life has changed for them. And so this is a key time to normalise and validate how they're feeling, and perhaps to signpost them to further support that can help them in that readjustment post-cancer treatment.
F. Fear of recurrence.
Most people will experience anxiety about the cancer recurring, but there will be some people who will need more support. So assess for symptoms similar to those for health anxiety, such as constantly checking and hypervigilance and seeking reassurance. Patients may need support to clarify how and when and how often they need to check, as this is sometimes unclear.
G. Greater Manchester referral.
There are many resources available for those affected by and living with cancer. This may be online, or at the treating centre, or at a local cancer support centre. And so it's helpful to know what's available in your locality that you can signpost your patients to.
Think A to G. A. Ask about psychological symptoms. B. Be alert to trauma. C. Cancer care review. D. Daily living. E. End of treatment. F. Fear of recurrence. G. Greater Manchester referral.
GatewayC Live, Greater Manchester. Fast facts, supporting earlier and faster cancer diagnosis.